as you can see, we could take the draft of what Sandoval County has put out, and we could just put this slide, some of these slides together, and you can go through this checklist, and you'll see that many of these things that Bob is suggesting are not in this oil and gas ordinance, and they're really trying to rush it through. And so we have to figure out how to slow down that process and how to do an oil and gas ordinance correctly. So that's, you know, I think he's done an incredible amount of work, and to have all of that documentation that he submitted as findings into the ordinance being ignored is something that, you know, we should really check the county on. So with that, we're going to come to our next speaker, Pegggy Breault. And Peg is a registered nurse, and she's done some research in the past on different specific issues with the health effects. And she's going to talk about health effects on fracking today. So thank you, Peg, for coming.
Thank you. Hi, how are you guys? Thanks to Bob. That's a PhD thesis on how to get an ordinance passed. So I'm a registered nurse. I worked mostly in cardiology, but I also worked in medical research. I've had asthma all my life, and I've been so sensitive to, like this week. I've been more than sensitive to this week. It's cold, it's hot, the wind is blowing, it's dusty, blah, 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 blah. So it makes me kind of understand these climate issues a little better. How many of you have allergies or asthma? Yeah, that's, so 1 in 10 Americans have asthma. 1 in 10 Americans has asthma at this point. It's even probably higher for hay fever. So I think we all kind of get it. So the name of, this is a slide program from a group called Physicians for Social Responsibility. And their title is Too Dirty, Too Dangerous. So you can look this up online and see this whole presentation by somebody else. But you're taking a certain risk when you put too dirty and too dangerous into your Google search. But so far, nobody's come looking for me with obscene stuff. Okay. Okay, so the good news is we've used oil and gas a lot and coal for the last 100 to 200 years. We have good alternatives. We live in a place that would be perfect to foster an industry based on solar and wind. We've had a hard time getting that started here in New Mexico. But we have an ideal solution to the problem of where we're going to get our energy, and we live in one of the best places in the country for that. Okay, too dirty, toxics we put in the earth. So what is fracking fluid? We know that some of the things in fracking fluid are known carcinogens. Mostly the ones that we can identify are benzene, toluene, and arsenic. They are called neurotoxins. They can give you headaches. They can cause birth defects. They can do other things to you. They're endocrine disrupting chemicals. That means that they can interfere with the way the hormones in your body are working. So hormones aren't all just estrogen and testosterone. There are lots of other things, and they regulate the body and finally tune it. And these chemicals can affect the body on that level. What we don't know is called proprietary business information. And that means that we don't know what's in the chemicals base that any given company is using. That's their right to use it without disclosing to everybody what is in that. It contaminates large volumes of water. So we also pull contaminants out of the earth. So there are things in the earth that are probably better off just staying there. Salts, radioactive materials, radon comes out when you do fracking. Heavy metals, PAHs, which is polycyclic hydrocarbon something, and volatile organic compounds. Volatile organic compounds, so when these compounds come out of the ground and they get into the air, they're called volatile because they go into the air. They can cause cancer, affect the nervous system, and cause birth defects. They can cause irreversible lung damage and significantly increase premature death. Particulate matter, so Fracking involves trucks, up to hundreds of trucks to any given well, coming and going all through the day, and they're bringing and taking things from the fracking site. This causes particulate matter to arise from the ground, and in New Mexico, we're very dusty. We don't have a lot of rain, so it could be worse than it has been in other places. So the particulate matter gets into your lungs and then can be absorbed into your bloodstream. So there's not only increase in heart attack, in asthma and hay fever and those kinds of things, there's also increases in heart attacks and other sorts of illnesses can ensue. Any questions about that? Any questions as we go along? Feel free to ask me. Children, of course, are particularly vulnerable. And as I know, I was born with respiratory distress and have had it all my life. It can be a long-term issue. But here I am. So what we know that benzene and toluene and those things are very bad for us. Particulate matter is bad for us. Fracking evolved sort of slowly. I worked in medical research. I worked on the H flu vaccine that's being used around the world for Johns Hopkins University. In order to get that on the market, we had to study that for several years on thousands of babies, and we had to prove that there were no significant side effects. Fracking can just be imposed upon a community, and these chemicals can be put into your air and into your water without having been tested. So fracking has been around for the last 15 to 20 years, and the data is starting to accumulate in a more solid way. At first, it was people in the community getting headaches, nosebleeds. We're fortunate enough to have somebody in the audience who was unfortunate enough to live in such an environment and suffered some of these symptoms and knew many people who suffered these symptoms. Now there is some strong scientific data coming out that there's a clear relationship between living near fracking wells and illnesses. So in Utah, they had very high levels of volatile organic compounds, similar to those seen in Los Angeles. So you're in this remote part of Utah, which isn't different from lots of parts of New Mexico, and you have as high ozone level as you would have in Los Angeles. It's just sort of scandalous. Colorado has dangerous airborne levels of benzene. Benzene is a known cancer-causing agent. And again, you breathe these things in, you get them through your water, they're going into your body just as a medication would. Your lungs are actually a more efficient way of absorbing chemicals into your body than a pill would be. So these things have potential to have strong adverse effects. The science shows that there is a statistical association between well density, that is how many wells there are in an area, increased rates of hospitalization for cardiac, neurological, urological, cancer-related, and skin-related problems. And these have footnotes to the studies. So you can look these studies up. They're good studies with lots of people in them, and they're more strongly proving that these things are bad. Statistical association between the patient's proximity to natural gas fracking operations and progressively worsening asthma symptoms. So in New Mexico, we spend about $5.8 billion a year on health costs related to climate change. So this can only increase what we spend on health costs. Inhalers for asthma without insurance cost $100 to $200 each. I buy 2 every month. I have insurance, so I don't pay that amount of money. This can be excruciatingly painful for a family. The people most affected by these things typically are poorer people, and so the burden of things like that is much higher on that population, and the death rate is higher. Asthma kills people. There are about 9 asthma deaths per day in this country. So I looked that up on the CDC website. So I'm not making these things up. I've looked everything up very carefully. And this is dangerous stuff, and asthma is pretty easy to understand because so many of us have allergies and asthma. And there are other things that this will affect, but the asthma is pretty obvious, and that's why I'm speaking to that. And the cost is pretty well known. Statistical association between density and closeness to wells, 10-mile radius, and mothers having children with congenital heart defects. So if you live within 10 miles of a fracking well, you are at higher risk of having a baby with a congenital heart defect. There's also increased risk of premature births close to fracking wells. I mean, almost an alarming rate of increased prematurity. Excuse me?
You talked several times about a close proximity. Is the 10-mile radius kind of close proximity for all those things, or, you know?
It affects everybody. It affects everybody in the state. Actually, I put a little information over there about the health effects of this kind of stuff in Arizona. And they quote the proximity to New Mexico as being part of a problem because of the issues that exist in the Four Corners. But the whole state generally will be affected, but the severity of the symptoms are dependent on how close you are to the well, for the most part, and how sensitive you are. Pardon me? They've done more fracking, and apparently they haven't been terribly careful in protecting the population from that. You know, the conduits are not secure. And it's kind of sad. It's a bad thing. And when we're all being affected by that, ultimately using fracking and using natural gas increases climate change. And again, we're all affected by climate change. I heard yesterday that you can't say climate change in the White House anymore. And I thought, well, I grew up in a Catholic family, and my parents never had sex, but they had 4 children. So you might not want to say climate change, but it exists. Are the EPA air standards strict enough? I don't think so. Again, as somebody who's been sensitive to this, I look at the air quality in New Mexico over the summer. We've had visible cloudiness, not cloudiness, density, air density. I live in La Luz, and I can look into Albuquerque, as I guess most of you can from Rio Rancho, and you can see the cloud down there. A couple of days, the particulate matter was moderate. A couple of days, it said 0. So I don't know that the standards are strict enough, because if you can see the air, chances are it's not that clean. There can be risks of episodic spikes in contaminant levels, and so the EPA standards don't account for that. And there are especially sensitive populations, pregnant women, young children, and the elderly. So that's a summary. There are numerous sources online. You can get in touch with me if there's anything in particular you want to ask about. And if you have any questions right now, I'd be happy to answer them for you. By the way, I drive through to San Francisco once or twice a year. My daughter lives there. And you see these fracking wells in the Central Valley. And it's ugly. And then the water is watering the crops. I mean, these wells are in the middle of the food we get from California. So I'm very suspicious now of food that says fresh from California.
Or I got an email or something about they actually use fracking wastewater to water organic crops.
Yes, exactly.
And why can't that stop? And how could they be?
That's the
declared
way the
organic?
law,
There's no specific regulations on it, so there is
Right.
no oversight.
And there's probably no hope of getting them now, at least on the national level.
I think if people like all of us are willing to be here on a Saturday morning, there's hope. I mean, I think that, yeah.
On the national level, there's hope.
We have our Ashla.
Asha?
Asha is here from New York, upstate New York, and you're speaking next.
I am.
And there was lots of local activism there, so I think there are things we
And
can
you.
do. Yeah. Alrighty, well, thanks for being here today.
Thank you.